Some common side effects include drowsiness, blurred vision, dry mouth, and dizziness. Some phenothiazines can cause urine to change to a pinkish red color. Sensitivity to sun exposure is common. Adverse reactions to phenothiazine drugs are most common at higher doses. As a result of blocking dopamine, a patient can experience extrapyramidal symptoms, EPS. The effects include tardive dyskinesia, acute dystonia, and neuroleptic malignant syndrome. Blood abnormalities are also possible while the patient is taking phenothiazines. These drugs should be avoided in patients with a cardiovascular disease because they can cause patients to experience angina, tachycardia, and/or orthostatic hypotension. The drug interactions of phenothiazines interact with a wide variety of drugs. They should not be given with the pro-motility drugs, metoclopramide, known as Reglan, which also affects dopamine levels. Phenothiazines can increase the effects of other drugs that affect dopamine, including the MAOIs and several other antidepressants. Benzodiazepines can increase the drowsiness as well. The phenothiazines should be avoided in patients who are taking levodopa-carbidopa in combination medicine for Parkinson's disease. The planning and implementation, in addition to the general nursing considerations related to antiemetic drug therapies. The following issues and actions are important. Carefully assess the vital signs in patients who are taking phenothiazines because these drugs can decrease blood pressure and increase the heart rate in some patients. Avoid giving a phenothiazine antiemetic to any patient who has low blood pressure or is dehydrated. Make sure the patient has the call light available to ask for help when getting out of bed after receiving the drug because it can cause orthostatic hypotension. Assess for any occurrence of EPS. If the patient demonstrates unusual muscle movements or has abrupt changes in temperature, heart rate, or blood pressure, notify the healthcare provider immediately. The patient and family teaching should include: you may experience dizziness, drowsiness, or blurred vision while taking this drug. Avoid driving, using any heavy equipment, or participating in dangerous activity. Change position slowly to avoid dizziness. Do not drink alcohol while taking this drug. Alcohol may increase the side effects. You may notice a slight change in the color of your urine to a pinkish red. This is an expected side effect. If you have any muscle spasm, particularly of the neck muscles, involuntary movements of the face, tongue, and upper or lower extremities, or any unusual restlessness, notify your healthcare provider immediately. The drug may decrease your ability to sweat, so make sure to avoid becoming overheated during physical activity or very hot weather. For relief of dry mouth, try sugarless gum or candy, or use ice chips to moisten your mouth. These drugs can cause your skin to be more sensitive to light, so avoid direct sunlight and, if needed, wear protective eyewear and clothing. Wear sunblock while outside to avoid sunburn. Cannabinoids, marijuana, a common street drug approved in some states for use in the medical treatment of certain health problems, has been used to help control the nausea and vomiting associated with cancer chemotherapy. Although many chemicals are present in marijuana, the one that has antiemetic actions is tetrahydrocannabinol, THC. All humans have THC receptors in many areas of the brain, including the CTZ and pleasure centers. Cannabinoids are natural or synthetic forms of THC that reduce nausea and vomiting. By binding to cannabinoid receptors in the CTZ and by preventing serotonin 5-HT3 from binding to its receptors in the CTZ. Use the cannabinoids as antiemetics is typically reserved for patients with severe nausea and vomiting that has not been relieved by other antiemetics because of the potential for addiction, rare but possible, and other side effects. According to the National Council of State Board of Nursing, the NCSBN, no nurse may administer cannabis unless authorized by jurisdiction law. It is critical for you to have a working knowledge of state and agency protocols guiding clinical practice before giving any cannabinoid. The nursing implications about the cannabinoids are typically reserved for patients who continue to have nausea and vomiting that does not respond to any other antiemetics. These drugs are typically given as an oral solution or in liquid-filled capsules, with the dosage individualized according to the body surface area calculations. These drugs are typically given according to the dosage that is determined by the healthcare provider in conjunction with the pharmacist. For liquid drugs, always use the proper measuring device to ensure accuracy. The first dose should be taken on an empty stomach 30 minutes before a meal. After the first dose, these drugs can be given with food. Advise patients to avoid alcohol, sedatives, and other CNS depressants because they may increase the risk of sedation. Monitor the patient carefully for changes in mental status. Cannabinoids can cause confusion, sedation, and sometimes feelings of euphoria or a high. These responses typically decrease after a few days of use. Examples of these drugs are dronabinol, known as Miranol, and nabilone, known as Casemet. While patients may be receiving Miranol, also known as dronabinol, to help control vomiting related to certain disease processes or treatments such as chemotherapy, may experience significant expected side effects. As we may know, nurses may find in that assessment, also known as objective data, significant mood swings or mood changes. May find that the patient has easier opportunities of laughter, increased awareness of environment. Patient may also have difficulty concentrating. Patient may also have emotional mood swings. And there may be some other things that a patient experiences and displays as part of that objective data that a nurse may observe. The most common side effects are related to the actions of cannabinoids in the CNS. Some patients experience a dose-related high, easy laughing, elation, and increased awareness. Other CNS effects are dizziness, anxiety, insomnia and difficulty concentrating, and mood swings or changes. Some patients may experience emotional liability, wide swings in emotion. These side effects may decrease after a few weeks of treatment. Some patients have GI side effects such as nausea and vomiting and abdominal pain. Orthostatic hypotension is more common in older adults. The adverse reactions, acute confusion, hypersensitivity, and seizure-like activity have occurred in some patients. Rarely hallucinations, excessive sweating, or fainting can occur, and it is important to carefully monitor the patient. Cannabinoids should be used with caution in patients who have a history of substance abuse, including alcohol, because of the increased risk of abuse of the drug. The drug interactions with cannabinoids can interact with a variety of other drugs. Some examples include warfarin, calcium channel blockers, opioid agonists, and a variety of antiretroviral drugs used to treat HIV. Patients who take dronabinol should avoid grapefruit juice because it can increase adverse effects. The patient and family teaching. To avoid using alcohol, sedatives, or any other anti-anxiety drugs with these drugs without talking to the healthcare provider. Take the drugs as prescribed, not to increase it without talking to the healthcare provider. To understand that this drug may cause them to feel slightly high, with feelings of easy laughing, mood swings, elation, and increased awareness. To make sure that the patient understands that these feelings should decrease over a period of a few days to a few weeks. Having the patient understand not to drive or operate heavy machinery or to participate in important decision making while they are taking this drug. Have or ask the family member to stay with the patient when they first start taking the drug in case they have some initial confusion or dizziness. Pro-motility drugs, also known as prokinetic drugs, increase contraction of the upper GI tract, including the stomach and the small intestines, and move contents more quickly through the GI tract. They do this by blocking dopamine receptors in the CTZ and the intestinal tract. They work similar to the phenothiazines but do not have the sedating side effect. Pro-motility drugs may be used in patients with post-operative nausea and vomiting, chemotherapy-induced nausea and vomiting, or gastroesophageal reflux disease, also known as GERD. They may also be used in patients who have difficulty emptying the stomach, such as patients with diabetic gastroparesis. The nursing implications would be to monitor the patient carefully for any mood changes or restlessness because these are common side effects. Check the vital signs regularly to assess for changes in blood pressure decreasing because there is a risk of orthostatic hypotension. Give these drugs at least 30 minutes before meals and at bedtime because these are times of increased potential for nausea. Examples of these drugs are metoclopramide, known as Reglan, and trenthobenzamide, known as Tigan. The most common side effects are drowsiness, fatigue, and restlessness. Others are visual impairment, urinary incontinence, and insomnia. Pro-motility drugs should be used with caution in patients with a history of depression because they can cause depression and suicidal ideation, seizures, blood disorders, cardiac dysrhythmia, and heart failure. Other adverse effects are related to decreased levels of the neurotransmitter dopamine. This can result in symptoms similar to Parkinson's disease, including tremor, bradykinesia, which is slow movement, and mask-like faces. These symptoms decline in 2 to 3 months after stopping the drug. More severe adverse effects include tardive dyskinesia, akathisia, and acute dystonia. Neuroleptic malignant syndrome is a rare life-threatening reaction to drugs that decrease dopamine levels. Pro-motility drugs are contraindicated in patients who are taking phenothiazine drugs, typical or atypical antipsychotics, or levodopa-carbidopa. Use of these drugs with certain antidepressants can increase the risk of serotonin syndrome. In addition to the general nursing considerations related to an antiemetic drug therapy, carefully monitor the patient for symptoms of restlessness, dizziness, and fatigue. This is especially important for the older adult who may be at greater risk for confusion or falls. Monitor the patient for Parkinson's disease-like symptoms such as tremor, slower gait, or mask-like facial appearance. If the patient experiences these side effects, notify the healthcare provider because the drug may need to be discontinued. The patient and family teaching: avoid driving and using heavy machinery or making important decisions while using this drug until you are aware of the effects that the drug will have on you. To avoid severe side effects, not to consume alcohol while taking this drug. If you experience depressive thoughts or suicidal ideations, notify the healthcare provider immediately. Inform the healthcare provider if you have any sudden increase in fever, muscle spasms, or difficulty in movement, because these may be signs and symptoms of a more serious healthcare issue. Drugs for peptic ulcer disease and gastroesophageal reflux disease. The lining of the stomach is usually strong enough to resist the powerful digestive juices and acids that aid normal digestion. Gastric distress may be caused when stress or disease produces excessive secretion of gastric acids, or when alcohol, chemicals, drugs, or disease damages the protective mucosal lining. And if the protective lining is not repaired or the gastric acid level is not reduced, duodenal and gastric ulcers are produced. This is known as a peptic ulcer disease, also known as PUD. It is associated with inflammation, pain, bleeding, reduced nutrition, and reduced quality of life. For many people, another problem is GERD, a condition in which the highly acidic stomach contents move backward, which is referred to as reflux, into the esophagus. The esophagus has no protection against the acidity and therefore can be damaged very easily. Drug therapies for PUD and GERD are essentially the same. Commonly used drug therapies include antacids, histamine H2 receptor blockers, and proton pump inhibitors known as PPIs, and cytoprotective drugs. More than one drug type may be used at the same time to help in healing the initial problem.